But the number one factor in low testosterone, especially in men, is stress. Welcome to another edition of In the Alpha Classroom. I'm Clifton Mack with the Alpha Male Clinic. And today we're going to talk about testosterone, or more specifically TRT, Testosterone Replacement Therapy. First of all, you might be wondering who is a candidate, or what are the symptoms of low testosterone? And there's a large variety. We'll talk more about this, but to name a few, lethargy. You know, if you're feeling like you need a nap in the middle of the day, that could be a symptom of low T. Unusual weight gain. Maybe you're gaining weight rapidly and it's not normal. Muscle loss. No matter how hard you work out, you can't seem to keep your muscle, or you're losing large amounts. Maybe you're sleepless. Many people don't realize, and this goes for women as well, is that low testosterone can be responsible for you waking up throughout the night. Men, we tend to think it's because we gotta wake up to pee, but the truth of it is, if you're in a deep enough sleep, most likely you won't wake up to pee. Progesterone helps you go to sleep, and testosterone keeps you asleep. Kind of interesting to realize that. Also, low libido. And this doesn't necessarily go to the fact that you have a normal erection, but maybe you don't desire sex. That's a factor. Now, as far as erections go, not all erections are made equal. If you're noticing a lower strength than normal, could be a symptom. Brain fog, this is a really interesting one. If you're finding at the end of the day that you're losing your train of thought, or you're forgetting what you were saying, that's a symptom. My partner, he actually is a medical director at a hospice facility where men and women are dying regularly. And what's interesting to note is that a good percentage of men in hospice are actually on testosterone replacement therapy. Kind of confusing. The stigma has always been that testosterone is about biceps, and it's really not. It's about us being a man. It's what we run off of. So God forbid your father gets dementia or the early signs of Alzheimer's, one of the first things they're going to recommend is testosterone, because it makes our brains work better. Factors that you might be wondering, hey, why do I have low testosterone? Well, the sad truth is being overweight actually lowers your testosterone. Of course, poor diet, poor drinking, not moving around. The more out of shape you get, the lower your testosterone gets. So you can see this is a slippery slope. But the number one factor in low testosterone, especially in men, is stress. The lowest testosterone scores we see in this clinic are actually, one, I'm going to say ex-military. PTSD wreaks havoc on the endocrine system. Large amounts of cortisol actually lower the testosterone, which I'll explain in a second. But the second lowest testosterone average score in this clinic is actually, I'm going to say, businessmen or women, entrepreneurs, salespeople, or just people in general that have a very high stress load on their job or their life. The reason for that is the primary stress hormone is cortisol. First of all, it's released in stressful times. They call it the fight or flight hormone. Well, it actually binds to testosterone receptors and robs you of your testosterone. Cortisol is the primary hormone responsible for aging. You've heard me say it over and over again, but that actually lowers your testosterone. I find men in here that are blown away with how low their testosterone scores are, because one of the problems is especially successful people, they attribute the fact that they get everything done in a day that they want to having normal levels, when really that's just a design of discipline. When you're disciplined, you're going to go throughout your day, you're going to go throughout your schedule, and you're going to do what needs to be done regardless of the way you feel, right? But when you're dealing with high levels of stress, it actually robs you of your manhood. So what do we do about it? Testosterone replacement therapy is prescribed in a lot of men with these conditions, or with low scores, or with just simply the symptoms of low testosterone that I've described. And what we prescribe the most and the most effective treatment for men, at least, is testosterone injections. Okay, I'm not a fan personally of the pellet method. I don't believe the release is sustained or is consistent enough. And with something as important as testosterone, there's a very clear science on keeping your levels as level as possible. You definitely don't want this to be happening. And I fear that's what really happens with a lot of people on pellets. So injections is the way to go. Weekly. If you currently are on a regimen, and there's many doctors out there that prescribe every 2-week injection. That is absolutely horrible. Your testosterone levels are doing this. So basically, men, you're having a man period every other week. And that's not a good thing. Minimum once a week. And for those that are more serious, you can go twice, even 3 times a week. To really balance it out and feel your best, perform your best, have the most energy. One factor in testosterone replacement, and again, I'm going to put a lot of doctors on blast right now, is they're prescribing testosterone injections or a form of testosterone without something to supplement the testes. It's just like anything else. If you give your body exogenous testosterone, your testes or your nuts, eventually they're going to stop working. It's kind of a misconception out there that your nuts are going to shrink if you take testosterone. Well, it's not entirely untrue. They're basically going to go dormant and they're going to tighten up and they will shrink temporarily. Now, the problem with testosterone replacement in men, 40 and up or 30 and up, is that if you shut those testes down, your nuts down, for a long enough period of time, they might not come back to life. What are we doing this for? Are we doing this to get jacked? Or are we doing this for health and longevity? Okay, so we don't sell testosterone without something to not only keep the testes working well, but even better than they were before. We prescribe a series of fertility medications, one being HCG if it's available, 2 being clomiphene. These things are used, like I said, in fertility clinics to make the testes work better. And we want to run that concurrently with the testosterone so that we're getting exogenous testosterone and then we're getting free testosterone. Nothing's better than free testosterone. Thirdly, we prescribe an anti-estrogen. There's a series of ones that we use for that, but basically the body's going to actually try to counterbalance an increase in testosterone by actually making more estrogen. And we don't want that to happen. We want the estrogen to remain low and the testosterone to be high. And we're not talking about normal levels. We're not in the normal business. We're in the hormone optimization business. So the goal of an anti-aging clinic like us is to get your testosterone levels to where they were when you were 18 years old, when you could go in the gym and build muscle, when maintaining a healthy weight wasn't as difficult, when everything worked better at that younger age. And so the right way to do testosterone replacement therapy is get a good physical from our doctor or your doctor, which we do here at our clinic, a good long blood panel. Most doctors' blood panels, you go to see your general practitioner, they're 2-3 pages long. Ours is 6 pages long because we want to make sure that we see everything, every hormone, every vitamin deficiency, everything. Not only to find out what we can balance, but to check for any red flags and make sure that testosterone replacement isn't going to be a bad thing for you. Because in 95% of men and women, testosterone therapy is actually very healthy and will actually increase your health. But we want to make sure we do our due diligence and do it the right way. That's the biggest thing is if you're going to do testosterone replacement therapy, you got to do it the right way, so that you can maintain your health and live to be 100 years old and have a great quality of life. Like we always say at the Alpha Male Clinic, getting old is a decision. We have the technology, we have the science to make sure that we're doing things the right way and increasing health, increasing quality of life. As always, thanks for viewing, like and subscribe to notifications. This is all free content we put out for your benefit so that we can all do this together and be our alpha.